Manheru akanaka. Nditete Gire ndauya nhasi. Ndiri kubata imwe handisina mbozivawo makore angu ese aya, ndakatozozvinzwirawo kunoku, saka handimboziva kuti ndamboti nditarise tasoti nechishona tinoiti hatitori nezita racho rechishona izvo, kuratidza kuti maybe kwedu kuchishona kwangu kusina here kuti zvinoitika izvozvo kurudzi kwedu. Ndiri kuuya nenyaya ye-postnatal depression kana kuti postpartum, hanzi baby blues or something like that, depression. Ndatarisa kunana Google nditsvaga kuti inonziiko nechishona. Vanokubudisa kusuruvara, yonzi postnatal kusuruvara. Hai, ndifunga kuti postnatal yacho ine zita racho rechishona kana unless pane anorizivawo. Ndimbomira ndinzwe kuti pane angaziva kuti zvinorevei nechishona, zvinonzii nechishona. Postnatal, iyo postnatal yacho timboona yoga isina depression. Hanzi depression kusuruvara, but postnatal shona handifungi kuti inomboriko kana shona to English meaning to English, postpartum English shona translate. Hapana parikutombobuda kuti aitoratidzwa kuti ichi yacho haitoriko, saka kuratidza kuti isusu vacho maybe takanga tisina zvionzi. Aiwa, tibvirapo, tora mwana uya mwisi uyu, wakanga uda kumusiyira ipapo, uda kuti tese nobody really understands you, kuti unatsonzi chichi kunatsoita kuti wazive kuti mahomoni achinja. Saka ndoda kumboti ndibate uyo kuti tinzoti English tushona hatinaba kuti postnatal tine depression chete nezita rokuti kusuruvara, which might mean kuti ndakasuruvara chaizvo ndekuti ndine nzara ndakasuruvara. So haina that depth kana seriousness yekuti because depression it's going deeper than just kungosuruvara. So kwedu isusu tongonero word kusuruvara for everything. Ndakasuruvara because I received bad news, ndakasuruvara, ndarambwa, ndakasuruvara. So ndo pamwewo peshona ipapo kuti hapana graveness ye-problem chita ipapo yakakusuwisa yacho, because inoenda nokuti wasuwa yakaita sei. Zvino paunzi postnatal depression, ndati nditsvage kuchishona uko handina kuzviona. Inini mozviziva kuti ndoda kutaura nyaya dzandikasangana nadzo, maproblems andikasanganawo. Iyi ndakumbira vakaita through it kuti vatiudzowo. Hani ndogara ndichikuudzai kuti kurwadza kweshangu ichikuitisa konzi kana blisters inozikanwa neakaipfeka. Ini handambopfeka bhutsu iyoyi yerudzuru, saka inini handingazivi kuti inokuitisa konzi wafamba nayo kwakareba sei. Ndida kunzwa kune vakaendawo through postnatal depression kuti after mazobvamo, how was it, how did you feel, wainzwa kuita se detach yourself here from the child yako yakaita sei. Moses vangoda kufanana necorona, tese tine madifferent symptoms atikaenda nawo mucorona. So I think postnatal inoenda pamuti mumwe munhu anenge asingadi kumwana and yakatrigwa nei. Ndichaisa apa indatotekedza nditongonotsvaka paGoogle kuya, nokuti ndokwaunotozowana dzimwe mhinduro kana dzashayikwa mukugara mukutaura. Then ndozisa imwe yevana yemadzimai ari kutaurawo what they went through. Kana wakaenda through that or going through it now, ziva kuti hausi wega and it can be treated. Well, we need support, actually support even from your partner, support from even friends, support from Hama when you are going through it. Kwete kuti vanhu vangokuita dismiss. I don't think it's right. Maybe kudismissa kusatonzwisanza anoyema, kuyema kwega akumbori kurema kuya. Mumwe munhu anga asikatoti kana kutakura mwana bhozi angatonzwa kana pain yekuti ruoko rutorwadza kutakura mwana. Imi mota bata mwana tambata nekumoko. Mwana ndiwako, iyo ukada kudai chichi neyedu yokutaurisa. Muri kutoisa munhu deeper. You need to understand kumubvunza kuti what's going on. Andione zvakaoma izvo kuti vanhu mubvunze kumunhu kuti chii chiri kuitika, how are you feeling. Tinozvitadza seiko zvinhu zvakadaro kuti tingobvunzawo mumwe wedu kuti uri kunzwa sei. Regai ndimbosanisa zvangu iyoyi kuti postpartum iyo depression vari kuti it's the same as postnatal depression, what they call baby blues, and dzofana kupera after a while. vari kuexplaina izvo kuti inogona kutanga uchangosununguka maybe 3 months, then inogona kutouya even after 1 year mwana otomanyaiwa, ndo pakutanga kutonzwa those depression moods idzodzo. Hanzi inongoya painowirawo, and nobody can really explain it. Saka I'll try to we'll play at this one. I think
Postpartum depression is moderate to severe depression in a woman after she has given birth. It may occur soon after delivery or up to a year later.
Sorry guys.
Most of the time it occurs within the first 3 months after delivery.
Causes. Okay.
The exact causes of postpartum depression known. Changes in hormone levels during and after pregnancy may affect a woman's mood. Many non-hormonal factors may also affect mood during this period. Changes in your body from pregnancy and delivery. Changes in work and social relationship. Postpartum.
And we invite us Zvakanaka. So we're going to take over from here.
Postpartum depression is moderate to severe depression in a woman after she has given birth. It may occur soon after delivery or up to a year later. Most of the time it occurs within the first 3 months after delivery. Causes. The exact causes of postpartum depression are unknown. Changes in hormone levels during and after pregnancy may affect a woman's mood. Many non-hormonal factors may also affect mood during this period. Changes in your body from pregnancy and delivery. Changes in work and social relationships. Having less time and for yourself. Lack of sleep. Worries about your ability to be a good mother. You may have a high chance of postpartum depression if you currently use alcohol, take illegal substances, or smoke, as these also cause serious health risks for the baby. Did not plan the pregnancy, or had mixed feelings about the pregnancy. Had depression, bipolar disorder, or an anxiety disorder before your pregnancy, or with a past pregnancy. Had a stressful event during the pregnancy or delivery, including personal illness, death or illness of a loved one, a difficult or emergency delivery, premature delivery, or illness or birth defect in the baby. Have a close family member who has had depression or anxiety. Have a poor relationship with your significant other or are single. Have money or housing problems. Have little support from family, friends, or your spouse or partner. Signs and symptoms. Some of the most common symptoms a woman may experience include feeling sad, hopeless, empty, or overwhelmed, crying more often than usual or for no apparent reason, worrying or feeling overly anxious, feeling moody, irritable, or restless, oversleeping, or being unable to sleep, even when her baby is asleep, having trouble concentrating, remembering details, and making decisions, experiencing anger or rage, losing interest in activities that are usually enjoyable, suffering from physical aches and pains, including frequent headaches, stomach problems, and muscle pain, eating too little or too much, withdrawing from or avoiding friends and family, having trouble bonding or forming an emotional attachment with her baby, persistently doubting her ability to care for her baby, thinking about harming herself or her baby. Diagnosis. Your doctor will usually talk with you about your feelings, thoughts, and mental health to distinguish between a short-term cause of postpartum baby blues and a more severe form of depression. As part of your evaluation, your doctor may ask you to complete a depression screening questionnaire, order blood tests to determine whether an underactive thyroid is contributing to your signs and symptoms, order other tests, if warranted, to rule out other causes for your symptoms. Treatment. Treatment and recovery time vary, depending on the severity of your depression and your individual needs. If you have an underactive thyroid or an underlying illness, your doctor may treat those conditions or refer you to the appropriate specialist. Your doctor may also refer you to a mental health provider. Postpartum depression. Postpartum depression is often treated with psychotherapy, also called talk therapy or mental health counseling, medication, or both. Psychotherapy. It may help to talk through your concerns with a psychiatrist, psychologist, or other mental health provider. Through therapy, you can find better ways to cope with your feelings, solve problems, set realistic goals, and respond to situations in a positive way. Sometimes family or relationship therapy also helps. Antidepressants. Your doctor may recommend an antidepressant. If you're breastfeeding, any medication you take will aid your breast milk. However, some antidepressants can be used during breastfeeding with little risk of side effects for your baby. Work with your doctor to weigh the potential risks and benefits of specific antidepressants. Medication. When your safety is assured, a combination of medications, such as antidepressants, antipsychotic medications, and mood stabilizers, may be used to control your signs and symptoms. Electroconvulsive therapy, or ECT. If your postpartum depression is severe and does not respond to medication, ECT may be recommended. During ECT, a small amount of electrical current is applied to your brain to produce brain waves similar to those that occur during a seizure. Thank you for watching our video. Please do not forget to like and share the video.
Saka inini ndaunza mavideo inokuti handitombonzwa handinzwisisi handiziviwo natal postpartum depression is something I never went through. Handina kumboti ndirambe mwana. I never got that feeling. Yangu yandikaita it was a short fuse yakangoita ndikanzwa kuti I have another boy. It depressed me for that second, but pandikamuka bva ndikaiswa mukurariswa ndakamuka nitsvaga mwana wangu handinazomubvomisa anyway futi. Saka I think that one was like a temporary one. Asi kana kuna akaenda through it, ini ndoda kunzwawo kune mamwe madzimai, if you went through it, it's nice to explain kune vamwe vari kuenda through it even now vabva mukusununguka mwana and so forth, so they might need help from hearing from you. Saka ndakumbira kuti akaenda through it ngaauyewo azobatsira pano, nokuti inini apa tete Gire aiwa handina hangu kuenda nazvo, ndiri munhu anotaura nezvangu zvandikaenda through, but iye handina mboendawo naye. Saka ndasikatozivi, ndatanga kutsvaga even kuti inonzi muchishona, hakuna postnatal, ndatoenda paGoogle ndazongoona yakanzi kusuruvara. You know, the depression part of it is kusuruvara, but postnatal, postpartum hamuna zvakadaro kwedu kuchivanhu, hapana meaning yacho. Saka apa ndakuda kumboisa one yemadzimai going through, talking about what they went through. Moms are kuita share. That's why I would have loved to have you moms come and share so that somebody else can also hear from you.
When I knew, I felt like I had the most wonderful experience after they had their baby, but I didn't know how to say, like, I'm freaking out.
Postpartum depression to me is the disconnect you have with your baby.
An overwhelming, uncontrollable sense of anxiety.
One of many mental illnesses that can affect mothers.
When I got pregnant, I was instantly in a bad mood. In addition to that, I had fibroids, which are tumors that grow in your uterus, and it was really scary.
I knew I had postpartum depression from the first time when I went to go and pump my breast milk at work, and I just broke down crying.
I actually remember saying to my husband, you know, people kept saying I'd be so emotional and I feel fine. And the reality of the situation was that I was completely emotionally numb.
Right after I had the baby, it was my husband's birthday, so I baked him a cake and I invited people over, and people were like, what are you doing? But I felt like it was my duty to celebrate his birthday, to try to nurse, and then come back and put on a happy face.
I believed that every parent around me knew what they were doing and that I was this devastating failure.
When my son was 4 months old, and I remember breastfeeding him, but he wouldn't stop crying. And I got face to face with him, and I screamed, "Stop crying." That was probably the moment I realized I needed help.
It's a really defeating feeling, knowing that this is something you have no control over.
I thought after that moment, I just need to hold my baby. I don't ever want this to happen again. And something has to change.
Being a stay-at-home mom was really isolating, but I felt like I kind of came out of it when I started exercising and hanging out with other moms.
I started feeling better when I could wake up to my baby every morning, and he just makes everything better and everything worthwhile.
To all the mothers going through this, surround yourself with people who get it, because you're not alone.
I know there's so much pressure right now to be like a perfect mom. You have to be honest. You have to let people in and let them know what you're going through.
If you are out there and you are struggling, I want you to know that it is going to get better.
I'm a mother, and I'm vulnerable, but I am capable.
And I am fighting every day.
And I'm doing the best that I can.
And struggling with postpartum depression didn't make me weak, but becoming victorious over it, that's what made me strong.
We have lost way too many moms. So please stay with us. Find yourself a community and keep fighting.
Okay. Nasi ndiri kungoisa mavideo because handitomboinzwisisa saka inini handonzoda kutaura zvinhu zvasinganzwisisa. I never want to make assumptions and trying even to pretend kuinzwisisa. Ndafunga pamwe ndichanawo 1 or 2 people who are alive enough to come and talk about the experiences they had, because ndakuudza kuti munhu kuti ataure nezvebhutsu yakaipa yakamupa konzi anenge akamboipfeka, iwe usina mboipfeka bhutsu yacho, is difficult kuti don't buy iyo yaiite inoitisa konzi, unzi wakamboipfeka inonzi no. Aiwa, ini handambopfeka hangu bhutsu yepostnatal depression, saka ndisiri kumbokwanisa kana kuti nditaure nezvayo, but zvinhu zvatosangana nazvo. Mutauro akaenda through it a few months after giving birth, I think straight after giving birth kumuzukuru wangu. Aingounza, but I didn't understand what it was. Aingoti ndaiwe nosirwa mwana maybe 3 days ari mucheche kudana nebhodhoro, ane maybe I think anga ari kuma 2 weeks or maybe kuma 1 month or 2 months ikoko. Ndaiwe nongosirwa mwana, ini ndaifara muzukuru wangu anga asingacheme kana kuti sei ainakidza kana kurera kuita baby sisa, ndaitofarawo kuti I'm bonding. Saka ndaingozouya ndosirwa mwana, but now when I think back, ndiri kufunga kuti I think Mutauro akamboenda through iyo postnatal depression. Saka the support iyoyo yandakapawo, it helped also for her to heal, and the support yaiwana from murume wakewo. I hope anga achinzwisisa to what it means, because sometimes it depends kuti uri kunzwisisa what it means here. Mapartner ekumusha or something vanogona kuti anoda kunetsa nokuyema, aiwa ndiye akatanga kuita mwana here, kana namwene ndo pamunenge muchikanda miromo yakadaro imba mamira izvozvo. Hakusi kuyema kana kuti sei munhu ari kutonetseka nehormonal imbalance iyoyo inenge yakaitika during pregnancy and childbirth. Choto chirwere chemental illness iripo iyoyo itozoti ikaregerwa munhu anozopedzisira. I remember mumwe mudzimai akazombva atoenda kunopenga, you know, asi kwedu kuchivanhu akabva amhanyirwa nzi ndofunga akaroiwa. Akaroiwa asatoita kutsvaka all those underlying things zvisipo kuti akaroiwa, saka ari kubehave like that, but it wasn't like that. Akanga atoita iyoyo postnatal, pano kusainzwisisa, the fact that we didn't understand kuti chii, maybe something that never really happened mu society medu, saka vanhu havanatsozvinzwisisa kuti chii ichocho, so they will have to find a way okufunga kuti chii ichocho. Ndofunga ndezvakati. Uyu ndiliani, she's talking about her own story yepostnatal. Ndangotsvaga vanhu vakapfeka shangu yacho vakaita cons. So she's talking about her experiences, but
my
you can
experience
see
of
the same.
postnatal depression was how hopeless life could be, I suppose. I thought it would be the happiest year of my life, and it really wasn't. It was horrendous.
Women will feel very low and sad, perhaps struggle to bond with their baby. They might be very tearful. They might struggle to leave the house.
I'd wake up in the morning and I would wonder how I was going to get through the day, and I would sit there and I would think, I've got this whole day ahead of me, and it's just going to be miserable, and I'm going to feel miserable. I wanted to be that mum who made all of the meals from scratch and breastfed her baby perfectly and went to every baby class there was and interacted with them constantly. That's what I wanted to be, but it was unachievable, and I was aiming for something that was totally unachievable anyway. I would get up and go out to these classes and put on a smile and pretend everything was okay, but inside I was literally falling apart. I started to feel, what's the point in being here, because I'm just going to feel the same tomorrow. And when I'd go to bed, I'd start lying in bed thinking, I hope I don't wake up tomorrow, because what's the point? I would just hope I wouldn't. So I told the psychologist that I was having thoughts of wanting to end my life. And at that point, she called the crisis team to ask them to intervene. With the extra support in place, things did start to look up then. It was a slow journey, but they did. If I hadn't had support from the perinatal mental health team, it does scare me that I wouldn't be here anymore. Mainly because if I hadn't had their help, I don't know how I'd ever have seen that light.
All right. From the little I've gathered, chandoda kupa advice if you are going through it now, if you are somebody, a mom out there, are going through it, there are structures and tools around, especially here in UK. Not sure to Kumusha, do we have anything in place like that? If there's nothing, I would advise you, Hama, even your best friend to try and come and support you. And also, iwewe mother, wacho, you need to admit that you need help. I don't pretend everything is all right, because mentally one day unogona kuzoita mwana. You heard the other girl at mwana wangu achema, then ndakamutaisa face to face, but this is just a baby. Akambamiti, stop crying. That's when she realized she's losing it and she needed help. But unogona kusava ipapo pesera wamusiya mwana wazuza mwana, or waita say in the end zvinokutuma kuita something like that, and you don't want to hurt your baby. Saka seek help. Bedwe, endai munotsvaka help. Vana mbuya nesu vana tete vechikuru kana muripo, sapotai muroora, angave muroora sukuru, angave chimusapotei until they come out of this doldrum. Anonida kuvepo imwe muchibatsira nemwana and talking to her, making it easier for her to the transition yokuve mother, especially kana mari mother for the first time. Anenge atori confused. Saka manzwa apa panzi you need help. Haikona kuramba kuti you need help, you need support. I think by emphasizing more of support, I think support around you, be support of the other mothers, join another mother in child groups. That way you can also learn from there and be friends, and you can find mama kinda through what you were going through, they can help you. Kana kuti munojoina unoenda kunonzi, you also talk to your doctor. Taura na GP wako what you're going through, and so that they can signpost you to the right, departments and in the tools they can give you to help you come out of it. Kana usina mboenda through something, I think you fail to understand what someone is going through. Because kana usina kweno vanhu vanofunga kuti waita mwana is where we all look forward to that. Kana une nhumbu unenge uchingofunga kuti ndaita mwana wangu and mwana wako is gonna be everything, and achibva afulfilla that gap yanga uchifila ya, then waita mwana waya, these other problems start arising, and you are trying to be the perfect mother. Ziva kuti hakuna perfect mother, you do the best you can with your child. In those and those you can hakuna understand I'm the best parent or I'm the best mother. You just try your best and you do your best, to come up with anything, right? My solutions or anything for your children. You just try to be your best. Just try to be the best mom you can be. Just try to be the best mom you can be. A perfect mom. Mwana wako ndiye anogona kuti you are my perfect mother. Nokuona kwanenge but you are not perfect. Ziva kuti hausiwe guy, and we all go through. Vese vamanofunga kuti he is a perfect parent. Nobody's perfect, and we all make those mistakes, and we are all trying. And I'll give you an example of a mother. Akauya mota mangu ni mwana wake ane 2 years. The 2-year-old, I'm telling you, she's grown up to be. If you look at her, you think she's 4. The way she talks, and she told me she just turned 2. But she's a different 2-year-old. And she was telling me akazvicheka negaba neplate or something, plate yakadona yakabva yatsemuka, but akupick a plate. 2-year-old. Saka aenda kuhospital naye vaswera varipo, akati hapana zvaitwa, mwana wacho anzi azodzoka, mwana azodwa mastitch. But I think I think they were trying to kuongorora kuti vaone kuti relationship yako nemwana yakaita sei, zvazvoita kuti mwana achekwe, this country with social services and everything. Akati, I try my best, blah blah blah, but chazonetsa kuti mwana wake achema, I think panga ane nzara, because aswera zuva rese akaiswa panzara achiti achaenda kusurgery, saka anga ari paneedle by mouth. Saka nezvozvo zvazvakuti ati acheme, afeel very frustrated mwana, and then paabatwa nanesi vechikuru vamwe vachida kuti vamupe calpol or something, vada kutora temperature or something like that, she called mai vavo a very bad word, she called a B word, and she was shocked kuti it's coming from a 2-year-old achidaro kuna mai vechikuru ivavo. Saka zvikanzi she's just a child, ndikati no, for them when they look at it, the words she said kwavari, it doesn't look like she's a child, it's like she knows what she's doing even at that age of 2 years. That's why maybe vazoswera newe vachikutarisa vachiongorora, they wanted to see kuti mwana yakaita sei, vachimustada sort of, and vanenge vatiita red flag, because yonzi pamwe mwana kumba uku kuno what type of environment is this child growing in. This has nothing to do with postnatal depression. This is just about being perfect. So even wakarwara ne whatever warwara, it doesn't make you an imperfect mother. There's no perfect mother, but we are just the best mothers who try the best we can in a given situation. And kanari mwana wako kutanga, I always say it's a prototype, it's a learning, you are a learner. Driving this vehicle that you don't really understand, but you want to get used to it. So you learn as you go. Like I wrote my book there, around the yearning to excel, a single mother's chain of love. I wrote it in here, I'm not perfect, and I kept on blaming myself maybe for most of the things maybe that went wrong with my children, and thinking maybe I'm not the best mother they can have, or I'm not even perfect enough. Every mother has asked herself that question, tinozvibvunza kuti handakakodzera here kuve mai vemwana uyu, handina kukodzera or something like that. Makatokodzera zvamuri ipapo, makatokodzera kuti tidwe. You just have to do that the best you can. Saka kana uri kunzwa kuti mwana hausi kuda uri detached from baby and usina anyone around, kana musina hama around dziripo to support you, or friends who are there to support you, you have got the NHS, and you have got the NHS, go to your doctor. You've also got the NHS, support system is there. Muri munyika muno. Kana kuri sokumusha, kokunzi padoctor unobhadharwa, vana mbuya variko kuna nani, you need to say it out kuti inini I think kana mwana ndikamutasa handitodi kana kumuyamwisa or something. There's a lot of triggers ndataura pamacauses nemasymptoms acho aripo, matriggers aripo aunomva waziva kuti I think inini I'm not natural. Why is it that I can't bond nemwana wangu? Zvinoitika ndo iyo postnatal, iyo postpartum yarewa baby blues. Mwana wako unenge wamusununguka uri looking forward to it. So kana paita something like that, then it's a red flag. You need to understand, to ask why it could be happening like that. Saka ndaona mana mai vangu vachitaura whatever they went through, ndakuda kuti nditaure nhasi nezvepostnatal, postpartum is something I don't really know, but I hope my videos and I play up anobatsira 1 or 2 people who are going through it. And just one thing last, and I'll just say, you don't blame yourself that you're not perfect. You are the perfect mother for that child. You are the best mom that the child can have. Just do the best you can. Nakusiyai nhasi ndinenge ndangoti nditaure nyaya diki diki, asi ngoita come across zviri continuous nezvemiscarriage zvataitaura musi wesvondo. Sunday iri kuuya tinoda kutaura, tinenge tichitaura nyaya yeukuroyiwa. I don't know. Yekuroyiwa, yekuita yemabad luck. It's our culture. I've been seeing pa Facebook apa vegokwe vanoburitswa natsika mukanda, tsika mukanda ndizvo. Taida kutaura nyaya iyoyo yokuti when you feel something is not happening well in your life, do you think wakaroyiwa, or you're just unfortunate, or you're just at the wrong place at the wrong time? And isn't that the right words in it? but I think ndizvo zvida kutaura tinzwa kuti pose panoitika zvinhu zvikasafamba mushe mukati meupenyu, do you believe kuti pane munhu ari kugadzira kuti zvinhu zvako zvisafambe, or you don't believe in that? You believe that it's part of your destiny and part of the challenges you meet along the way. Makristu vanenge vari makristu vasiri makristu, toda kuti timbouya timbonzwa kuti zvinhu zvikasafamba mushe, mangwana zviri kungoenda down south, do you think maybe you haven't listened to yourself yet, we made the wrong decisions, or uri kufunga kuti amheni ari kukubatira achikwira, vanokwira mugomo, vakwira mugomo havasi vemusho, havasi varoiwa kuti uri kuroiwa here kana kuti uri kutumirwa zvinoita kuti zvinhu zvisafambe, pane ari kugadzira kuti zvinhu zvako zvisafambe. Do you believe that? Toda kuti tisanganiswe svondo tichitaura nyaya iyoyo. So ndakusiya zvangu pana, goodbye, ndimbozorora ndikozoenda kubasa. Thank you so much. I know kuti murimo mumaterasu. Thank you for hiding in the terraces and watching. See you on Sunday. Timbotaura nezvekuroiwa. It's our culture. Juju. I don't know that tida kuti compare kuziva kuti black magic white magic pane zviri different kuvarungu, zviriko here zvekuroiwa, because vanawo mediums as well, but witchcraft nemacoven ariko, but avo anoshanda kuita sei, edu echivanhu anoshanda kuita sei, ngasanganiswe zvona. I leave you now, and I plead the blood of Jesus on each and every one of you as we go towards my weekend.